On October 18, 2019, the World Economic Forum, along with the Bill and Melinda Gates Foundation and Johns Hopkins University Center for Health Security, held a tabletop pandemic exercise called Event 201, in which they simulated the outbreak of a novel coronavirus 6 weeks before the actual outbreak of COVID-19 occurred.
A new coronavirus spread silently within herds. CAPS is a novel coronavirus related to those viruses that caused the frightening SARS epidemic in 2003 and the deadly MERS outbreaks in recent years.
Now, all the information I present here is documented, factual information that can easily be verified on their own website, as shown here. Let's take a look at the event scenario as they describe it. Event 201 simulates an outbreak of a novel zoonotic coronavirus transmitted from bats to pigs to people. There is no possibility of a vaccine being available in the first year. The pandemic will continue at some rate until there is an effective vaccine. The scenario ends at the 18-month point. Where have I heard 18 months before? Sounds so familiar.
Corona, virus, and disease. He also said the first vaccines could be ready in 18 months. Ready in 18 months. 18 months.
18 months.
The most urgent invention in the world right now is a vaccine that prevents you from getting COVID-19. So the Gates Foundation, along with a great number of partners, are looking at these different efforts. We've never created a new vaccine in less than 5 years. So this is urgent, and it's going to require incredible collaboration. It's going to have to go to 7 billion people. So I am optimistic that one of the vaccine efforts will give us vaccines in the next 18 months. And will give us vaccines in the next 18 months.
In the next 18 months.
18 months. And we'll make sure that it's produced in volume and that it's accessible to everyone in the world. That's how we're going to end this pandemic.
Anyway, I think I've stressed that point enough. Enjoy Event 201.
Hello, everyone. I'm Anita Cicero, Deputy Director of the Johns Hopkins Center for Health Security. And today I will be your Master of Ceremonies for Event 201. On behalf of our center and our partners, the World Economic Forum and the Bill and Melinda Gates Foundation, I'd like to extend a very warm welcome to our audience here in New York, as well as our larger virtual audience participating online today.
Welcome to Event 201.
It began in healthy-looking pigs, months, perhaps years ago. A new coronavirus spread silently within herds. Gradually, farmers started getting sick. Infected people got a respiratory illness with symptoms ranging from mild flu-like signs to severe pneumonia. The sickest required intensive care. Many died. At first, the spread was limited to those with close contacts, healthcare personnel, co-workers, and families. But now it's spreading rapidly throughout local communities. International travel has turned local epidemics into a pandemic spanning the globe. Just 3 months ago, CAPS started in South America, but has now reached several countries with more than 30,000 cases and nearly 2,000 deaths. CAPS is a novel coronavirus related to those viruses that caused the frightening SARS epidemic in 2003 and the deadly MERS outbreaks in recent years. Scientists think each infected person in turn infects on average 2 more people. This disease is proving more transmissible than SARS or MERS and about as contagious as influenza. Essentially, the cumulative number of cases is doubling every week. At this rate, we can expect to see 16 times as many cases in a month unless we find a way to interrupt transmission. The virus appears to be spreading rapidly in densely populated and impoverished neighborhoods in some megacities in South America. CAPS is a serious respiratory disease. More than half of the recognized cases have required hospital care, creating a huge strain on healthcare systems. The fatality rate is about 10%. For comparison, CAPS is about as lethal as SARS and 2 to 4 times more lethal than the 1918 influenza pandemic, the worst pandemic on record. Even so, some people only exhibit mild flu-like symptoms, not requiring treatment in a hospital. Alarmingly, those people are able to walk around and spread the virus, not realizing they are doing so. Even worse, international travelers have been arriving at their destinations symptom-free, but within a matter of hours, becoming ill. Travel-related cases have blossomed into outbreaks in a number of locations and have quickly grown faster than health authorities could respond and contain them. In other places, physicians have quickly recognized the symptoms of CAPS and have been able to isolate infected individuals and avoid an outbreak, for now. Global public health experts are very concerned about this disease because it appears the virus is readily transmitted through the air from person to person. Essentially, all people are susceptible. Experts agree unless it is quickly controlled, it could lead to a severe pandemic, an outbreak that circles the globe and affects people everywhere. Models developed by leading public health authorities indicate a CAPS pandemic could lead to an outcome worse than the 1918 influenza, which killed 50 to 100 million people worldwide. Given the global population is 4 times larger than it was in 1918, if these models prove accurate, we could be looking at hundreds of millions of deaths over the next year or 2.
Now let's recap. They had an exercise of a pandemic, a novel coronavirus outbreak, 6 weeks before the outbreak of a novel coronavirus, which is COVID-19. I mean, for anyone to think that this is merely coincidence is just beyond my understanding.
In related news, a significant demand for personal protective equipment like N95 masks and gloves are on the rise due to the pandemic. However, globally, hospitals are running low. Additionally, other critical medical supplies such as saline and antibiotics are dwindling. Countries and companies are reportedly stockpiling supplies, disrupting healthcare supply chains, causing dangerous shortages in many parts of the world.
Now, not only do you have the N95 and PPE shortage that really ended up happening, but looking back, there was even the 18-month time frame that they adhered to, which was described in the scenario from their website of Event 201. I mean, how many fucking coincidences does it take before it's not a fucking coincidence anymore? I mean, Jesus fucking Christ.
Which control of information should there be? And by whom? And how can false information be effectively challenged? And what if that false information is coming from companies or from governments?
Polls have shown that mis and disinformation are ubiquitous. At least 90% of the public has been exposed to these messages. At the same time, misinformation messages come from a variety of sources, even government officials. And often governments are contradicting one another.
Twitter and Facebook are reporting they've identified and deleted a disturbing number of accounts dedicated to spreading disinformation about the outbreak. For more on this, we go to our correspondent, Catalina Parks.
Chen, these accounts were created by several state-sponsored groups intending to sow political discord, and some individuals are seemingly seeking to gain financial advantages.
But it's not just trolls who are spreading the fake news. It's often political leaders themselves. Who's to judge what's real or not? Would we trust every government to separate truth from lies?
Now, they're even telling us how most of the misinformation and disinformation, or at least a large part of it, is going to be put out by companies and governments and political leaders. And one of the main reasons why is to convince you and the large part of the population that it's nothing more than some crazy conspiracy theory. And they go to great lengths in order to do so, like this guy.
Hello, this is Dr. Grande. Today's question asks so I can analyze the Bill Gates coronavirus conspiracy theory. Just a reminder here that I'm not diagnosing anybody in this video, only speculating about what could be happening in a situation like this. The next item is this Event 201. This was a simulation about a coronavirus. It was a coronavirus more like SARS. And it really makes sense considering the health security focus of the organization that conducted it. I understand this is a little suspect. It did seem coincidental that it happened not long before the novel coronavirus pandemic. But even if it was not a coincidence, and I think it was, the best argument would be that they somehow knew about the threat, or they knew that a coronavirus could get out of control. We see he's one of the largest donors to the World Health Organization. We see this argument that he funded the Pirbright Institute and that they have a patent on a coronavirus. So this seems to look suspicious. We see this discussion of Event 201. This event was hosted in 2019 by the Johns Hopkins Center for Health Security. It was really a pandemic tabletop exercise, and several partners were involved, including the Bill and Melinda Gates Foundation.
Now, this is where it gets extremely ridiculous, and he says the term conspiracy theory or theorist over 40 times in this one talk. And what's sad is he's considered a mental health professional, but is anything but professional.
So first I'll look at this conspiracy theory. This is a fast-growing conspiracy theory. Popular conspiracy theories, common conspiracy theories, the conspiracy theories. So if this conspiracy theory is, so how is this conspiracy theory? Conspiracy theories are conspiracy theory. So that's really what we see here in this conspiracy theory. Also, a number of conspiracy theorists. What conspiracy theorist? We also see the conspiracy theorist, and we see here that conspiracy theorist, or at least as it's outlined in the conspiracy theory, and what the conspiracy theory now says. And that's kind of been used as part of this conspiracy theory. Again, this is a far distance from what the conspiracy theory alleges. Then the last part of this conspiracy theory is conspiracy theory, but is really still far from a conspiracy theory. Also, I find it interesting that people think that he's involved in this conspiracy theory because if he was part of a conspiracy, when does he capitalize on this conspiracy theory? So is there other evidence that would refute this conspiracy theory if the conspiracy theory rises to that level? So is this conspiracy theory? Then the last item that was talked about in the conspiracy theory was a lot of the mental health professionals that are seeing a number of people coming in with these conspiracy theories. Can't believe there were this many people who believed in these types of conspiracy theories. Now, just to be clear, somebody can believe in this conspiracy theory and not have a mental disorder. But some people who believe in this conspiracy theory appear to have symptoms of mental disorders. Conspiracy theorists are quite vocal, too. I think this is one of the reasons this conspiracy theory stands out. So people who do not believe in this theory aren't going to say that. They're not going to make a lot of posts on social media or videos or just really tell anybody. But people who believe in it, again, tend to be more vocal. How about this connection to Pirbright Institute? Now, they do study coronaviruses, and they do have a patent on one, and they have received money from the Gates Foundation. However, this biological research organization holds a patent for a coronavirus that primarily affects chickens. So I guess unless chickens are getting together and saying there's a big conspiracy, there's really not much to see here. This makes me wonder, though, if chickens did have conspiracy theories, would they still have alien reptile people, or would it be something that's more threatening to them specifically? Like, would it be alien fox people? Because chickens have, I would think, a fear of foxes at some level. Foxes are known to kill chickens. So it's just a thought. I really haven't asked too many chickens about conspiracy theories, but that's interesting. They have a better argument to make based on at least this one piece of evidence. Supports the conspiracy theory. It's really a logic error. So somebody is kind of sitting there, they're seeing different information come by, and they just pick out the information that supports the theory. So what's the bottom line with conspiracy theories like these? Well, misinformation is more infectious than coronavirus. And in the end, it may turn out to be more deadly. I know whenever I talk about topics like conspiracy theories, well, there you go. That proves something's going on here. That could not have been random.
If you like this video and the content, please give it a like and subscribe, and let me know what your thoughts are in the comment section.